Welcome to the deep dive. Today, we're zooming in on something you probably use constantly without a second thought, your wrist.
It really is incredible, isn't it? Such a small area, but wow, the complexity.
Exactly. Think about it typing, lifting, scrolling. It's always working.
Huh?
So, our mission today is to really understand what makes it tick. We're going to dive into the anatomy, the bones, ligaments, muscles, nerves, blood supply, the whole package.
Sounds good. We've got some great source material to guide us through it.
Perfect. Okay, let's start with the foundation, the bones.
Right. So when we talk about the wrist joint proper, we're mainly looking at the radiocarpal joint.
Radiocarpal. Yeah.
And it's what's called a synovial condyloid joint.
Hmm.
Fancy term. Basically, it means it can bend, straighten, and wiggle side to side. Lots of movement.
Right, okay. So which specific bones are involved in that main joint? It feels simple, hand meets arm, but I guess it's more intricate.
It definitely is. You've got the end of the radius that's the bigger forearm bone on your thumb side, connecting with the first row of little carpal bones in your hand. Specifically the scaphoid, the lunate, and sometimes the trichotrum gets involved too.
Okay, scaphoid, lunate, trichotrum. But hang on, what about the other forearm bone, the ulna, on the pinky side? I always assumed it was part of the main joint.
Yeah, that's a really common thought, but nope. The ulna doesn't directly connect to those carpal bones in the radiocarpal joint.
Really? So what's going on there then? Is there just a gap?
Not quite a gap. There's this really interesting structure called the triangular fibrocartilage complex, TFCC for short.
TFCC. Okay, sounds important.
It is. Think of it like a high-tech cushion or a meniscus, like in your knee, sitting between the end of the ulna and those carpal bones.
A cushion, so it absorbs shock.
Definitely absorb shock, especially when you put weight through the pinky side of your hand. But it also does more. It's key for stability and helps transmit load across the wrist.
And does it help with movement too?
Yeah, critically. It helps stabilize the joint when you rotate your forearm, like turning a key or a doorknob. It lets the radius move around the ulna smoothly while keeping the wrist itself stable. Pretty clever design.
Wow, okay. TFCC. Never knew that was there. So we have the bones and this cushion, but what stops everything from just, falling apart or bending too far? Ligaments.
Exactly. Ligaments are the unsung heroes here. They're like really tough, slightly elastic straps connecting bone to bone.
Keeping it all snug.
Precisely. They maintain the joint's integrity and, crucially, limit excessive motion, prevent sprains.
So which are the main ones we should know about?
Well, on the palm side, you've got the palmar radiocarpal ligament. Runs from the radius to the carpals.
Okay.
And it's really important for resisting too much too much forward bending flexion. Stabilizes during flexion.
Got it. Flexion, palm side. What about bending backwards, extension?
For that, you look at the back of the wrist. The dorsal radiocarpal ligament does the opposite job, supports the joint during extension.
Makes sense. Dorsal for back, palmar for palm. What about side-to-side movement, like waving?
Yep, collateral ligaments handle that. On the thumb side, there's the radiocollateral ligament. It goes from the radius to the scaphoid.
And what does it stop?
It primarily resists ulnar deviation that's bending your hand towards your pinky.
Okay. And the other side, pinky side.
That's the ulnar collateral ligament. Connects the ulna to the trichotrum and another little bone called the puciform. This one resists radial deviation, bending towards the thumb.
So they work in opposition, kind of?
Exactly. They all work together, this whole network, providing stability through all sorts of complex movements, like a finely tuned suspension system.
Great analogy. Okay, structure, stability. Now, the power, the muscles that actually move the wrist, they're mostly in the forearm, right? Not the hand itself.
That's right. The muscles providing the main force for wrist movements are located in your forearm. They have long tendons that cross the wrist joint to attach to the hand bones.
And we group them, generally.
Yeah, mainly into flexors on the front or anterior side, they bend the wrist forward. And extensors on the back, the posterior side, they straighten it or bend it backward.
Plus some help with those side-to-side deviations we mentioned.
Correct. Some muscles do double duty, flexing or extending, and helping with adduction towards the pinky or abduction towards the thumb.
Okay, let's tackle the flexors first, the ones on the palm side.
Sure. You've got the flexor carpi radialis. It flexes and abducts, pulls towards the thumb side.
Okay.
Then the flexor carpi ulnaris flexes and adducts, pulls towards the pinky side.
Right.
And there's often the palmaris longus, a thin muscle that helps with flexion. Though, fun fact, maybe 10–15% of people don't even have one.
No kidding. Does it matter?
Apparently not much for wrist function, as often used for tendon grafts if needed elsewhere.
Huh. Interesting. And what about the finger muscles? Don't they cross the wrist?
Absolutely. The big muscles that curl your fingers, flexor digitorum superficialis and profundus, their tendons run through the wrist too.
So they help flex the wrist as well.
They do, yeah. Especially when you make a fist. You can feel them working in your forearm when you grip something tightly. They contribute significantly to overall wrist flexion strength.
Makes sense. Okay, let's flip to the back of the forearm, the extensors.
Right, so you have the extensor carpi radialis, longus, and brevis. These extend the wrist and also help abduct it, pull it towards the thumb side.
Longus and brevis. Two of them.
Yeah, working together. Then there's the extensor carpi ulnaris, which extends and adducts, pulls towards the pinky.
Okay, mirroring the flexor side.
Pretty much.
Okay.
And like the flexors, the main muscle that straightens your fingers, the extensor digitorum, also crosses the wrist and helps with wrist extension.
It's amazing how many muscles are coordinating just for those seemingly simple wrist movements, like when you're typing or using a tool.
It really is. Fine motor control combined with strength, it all comes from this complex interplay in the forearm.
Okay, muscles provide the movement, but they need instructions. Let's talk nerves. How is the wrist wired?
It's primarily innervated by three major nerves traveling down from the arm: the median nerve, the ulnar nerve, and the radial nerve.
The big three. Okay, let's break them down. Median nerve.
The median nerve is a big player. It supplies most of the flexor muscles we just talked about,
Okay.
and maybe more famously, it provides sensation to the palm side of your thumb, index, middle finger, and half of the ring finger.
Ah, so that's the nerve involved in carpal tunnel syndrome.
Exactly. When that nerve gets squeezed as it passes through the wrist, you get those classic symptoms: numbness, tingling in those specific fingers.
Right, okay. What about the ulnar nerve?
The ulnar nerve handles the flexor carpi ulnaris muscle and part of the flexor digitorum profundus, specifically the part that bends your pinky and ring fingers.
So more on the pinky side.
Yeah, and it provides sensation to your pinky finger, the other half of your ring finger, and that side of your palm. It's the one you notice if you hit your funny bone. That tingling sensation travels down its path.
Ouch, yeah, we know that one.
Okay.
And the radial nerve.
The radial nerve mainly takes care of the extensor muscles on the back of the forearm. So wrist extension, finger extension.
Powering the straining movements?
Correct.
Yeah.
And it also provides sensation to a patch on the back of your hand, mostly near the thumb and index finger area.
So damage to any one of these could really affect both movement and feeling?
Absolutely. Proper nerve function is crucial for both coordinated action and the sensory feedback you need to, grip things correctly or know where your hand is.
Makes sense. Now, all this tissue, muscles contracting, nerves firing needs fuel. How does blood get supplied to the wrist?
The blood supply comes mainly from two arteries running down the forearm, mirroring the bones, actually. The radial artery on the thumb side.
The one you feel for a pulse.
That's the one, yeah. And the ulnar artery on the pinky side.
Okay. And they just supply the wrist directly.
They branch out quite a bit. We form these intricate networks, these arches of smaller vessels around the carpal bones. The radial artery heavily contributes to the dorsal carpal arch on the back.
Dorsal back. Got it.
And the ulnar artery is a main contributor to the palmar carpal arch on the front.
Arches. So they connect up. Is there like a backup system?
There is. That's a key feature. These arches involve lots of connections called anastomoses. Think of it like multiple routes on a map.
Ah, so if one path gets blocked.
Blood can still find its way through other connections. It's a really important safeguard to ensure the hand and wrist tissues get continuous blood flow, even if one vessel gets compressed or injured.
That's clever redundancy. Okay, so we've covered bones, ligaments, muscles, nerves, blood supply, the whole anatomical map. How does knowing all this detail actually help in, say, a clinical setting?
Oh, it's fundamental. Understanding this anatomy is absolutely critical for diagnosing and treating wrist problems.
Like what, for example?
Take a collis fracture. Super common wrist injury, especially from falling on an outstretched hand.
Right.
It's a break in the distal radius, right near the joint. Knowing exactly how the radius articulates with the scaphoid and lunate, understanding the ligaments that might be torn, knowing where the nerves run. All that helps the doctor figure out how bad the break is, if the bones are displaced, and the best way to fix it: cast, surgery, whatever.
Okay, so it guides treatment. What about something like carpal tunnel, which we mentioned?
Perfect example. Knowing the anatomy of the carpal tunnel, that narrow space formed by the carpal bones and the transverse carpal ligament on top, and knowing that the median nerve and all the flexor tendons have to squeeze through there, makes it clear why repetitive motion or inflammation can compress the nerve. Understanding those spatial relationships is key to diagnosis. and deciding if treatment like splinting or surgery to release that tight ligament is needed.
It really drives home how structure dictates function and dysfunction when things go wrong.
Exactly. You can't really treat it effectively if you don't understand the underlying machinery.
So, wrapping up, we've peeled back the layers on the wrist. It might be small, but wow, it is packed with intricate, vital structures.
Absolutely. It's a masterpiece of biological engineering, really. The way the bones fit, the ligaments stabilize, the muscles power, the nerves control, the vessels nourish, it all works together seamlessly most of the time.
It's quite humbling, so maybe a final thought for everyone listening. The next time you pick up your mug, or wave hello, or play an instrument, just take a half second. Think about that incredible network of bones, tissues, and signals working inside your wrist, making that simple action possible. It's pretty amazing stuff happening right there at the end of your arm.